Friday. It is 5:38 in the morning. Today I have another appointment at Cleveland Clinic and we have to travel an hour and a half to get there. So now I gotta get myself ready, get the kids up, get the kids ready, drop Megan off at the babysitter's, drop the boys off at their friend's house. Their friend's mom is going to put them on the bus for me today. And then we'll travel to Cleveland Clinic. I have to see the doctor, and then I'm going to get a new IV treatment, and it is a 4-hour infusion of the medicine, and I'm hoping that this is going to work with my RA. And yeah, so it's going to be a busy day, but I'm very hopeful that everything is going to go well. Everybody's getting ready to walk out the door.
I'm going in.
Hi.
So we are on our way to Cleveland for my appointment, and I'm going to be getting a 4-hour treatment, which is the IV infusion of medicine to try to treat my rheumatoid arthritis. Yes, if you are just tuning in for the first time, I have rheumatoid arthritis. I was diagnosed 9 years ago, and I was 24 years old. Yep, 33 now, yeah. So I was 24 years old, and I woke up one morning and I felt like I had the flu, but really bad. Like I couldn't walk, I had fevers, chills, I was a mess. And so my family doctor sent me to the emergency room. From the emergency room they admitted me, they ran all kind of tests, and within a couple days I was diagnosed with rheumatoid arthritis. I have not always gone to Cleveland Clinic. I just started going there about a year and a half ago or so. And I have seen a couple other different rheumatologists in my area where I live, but it didn't work out. They never seemed to want to try new medicines, and my condition just wasn't getting better. So I'm happy that I decided to make the commute to Cleveland Clinic because they have been excellent with my treatments. They have been willing to try new medicines and get me back to being a healthy 33-year-old young woman, not like an 80-year-old old woman. So we are headed on our way. It is now 7:17. The kids are all dropped off where they need to be, and now we are making our commute. We got some Dunkin' Donuts on the road.
Dunkin' Donuts. We'll leave the light on for you. 2 different commercials in one.
And he asked for a small coffee.
And I got a mini.
And he got like a mini little baby coffee.
This is my mini caramel latte double shot espresso.
Okay, safe driving, Jason.
Let me see your chest.
Hi guys, sitting in the chair, getting my medicine. Pray that it works. I'm getting hungry.
You're always hungry.
He's about to go get me some food.
I don't know about that.
Yes, you are. You know me. Hi guys. So I'm all done with my treatment and things didn't go quite as planned. We should have been out of there about 2 hours ago, but I was having an allergic reaction to the medicine. So it was nothing major. It was just where they were putting the IV in. First they put it in my hand and it like swelled up and turned red. So then they took it out and put it in my arm. And again, it turned red and became really itchy. So then they gave me an IV Benadryl, a shot of Benadryl in my IV, and that controlled it. So then the IV infusion is 4 hours long, so it kind of set everything back to where they didn't even get anything going until like noon, and we just got out of there and it's 4:14 now, but we had to walk to our car and get out of the parking garage and whatnot. So now we have about an hour and a half to drive home, and I can't wait to go home and see my kids. And I'm probably gonna sleep most of the day because Benadryl makes me really tired for like 24 hours. So yeah, that's what's happening. It's a beautiful sunshiny day. Kind of stinks we had to spend it sitting in this little treatment room all day. But I'm hoping that this medicine will work, and they said that I should start to feel a difference within maybe a few days, maybe a week, and then I gotta come back in 2 weeks and do it all over again. And then after that follow-up infusion, then you only have to come once every 6 months. So that's really nice that I won't have to come all the time, like once a month or once every other month. It'll be every 6 months after that. So please keep me in your prayers that this is going to help my RA. And I'm not sure if I've ever shown you guys my hand, so I'm going to show it to you now so you could see what it looks like when someone has rheumatoid arthritis. So as you can tell, my fingers are so swollen, it hurts to bend them. When I go like that, my whole hand hurts, and as you can tell, it's so swollen. I have a lot of pain in my left hip, which they're saying eventually I'm going to need to get a hip replacement, but they're trying to use medication to control the pain so I can hopefully hold off on having to have a hip replacement. But the x-rays are showing that the arthritis is destroying my hip. And I did have a knee surgery in 2010. They cut my knee open like they would with replacing your knee, but they went in and like scraped out all the arthritis and scar tissue, and I never really recovered all that well from that. I mean, I can walk and things, but it does cause me a lot of pain. And then like a year after having that surgery is when my hip really started going bad. And I get a lot of pain in the back of my neck, like right where your skull and your neck meet. And I've been on so many different medicines over the last 9 years, and prednisone is your worst enemy. It like makes me blow up, and I really got to control eating so I don't get huge. But yeah, so I had to get a shot of prednisone today, so I'll feel good for a few days with the injection of steroids, but I don't really like to get those. So yep, this is my day. We're driving home. That's my chauffeur.
Good day, ma'am.
You ready to go home?
Yes.
There are medicines that I have to take on a daily basis and vitamins. Hey guys, so I wanted to let you know that this footage was actually recorded a few months ago. I just stuck it on the computer into a folder in my documents, and I held on to it until I was ready to share it with everyone. And the reason why I am sharing this is because I want people to know what it's like to have rheumatoid arthritis. I am 34 years old and I feel like I'm 80. Everything aches, and I do have some good days. And in some of my videos, you'll see me dancing, you'll see me playing with my kids, you'll see me being normal, like what a normal 34-year-old person should be doing. But a lot of the times, like if I'm having a good day, at the end of the day, when I sit and I stop or I go to bed, that's when everything starts to hurt. And I can say that the medicine that you did see me get in this video did work, and I did have a reaction the first time, but after that I did not have a reaction when I went back the 2 weeks later for the second dose. And then since then I have actually had another dose. So all of this that you've seen was actually recorded about 7 months ago. Yeah, gosh, I've held on to it for a long time. And so since then, I've had another dose, and I did not have a reaction, and it has worked really good. He is a very caring doctor. He's always willing to listen to me and not kind of just tell me what to do. He actually wants my opinion, like, how do you feel? What do you think about this? And I really like that about him. He has really good bedside manner, and he's been my doctor for 2 years, maybe almost 3. I think June will be 3 years that he's been my doctor. And I really like him. I'm not sure that I'm going to be going back to that facility to actually get my next treatment. He is going to try to see if maybe one of the hospitals right here where I live, we know that there's like a cancer center that's only like 15 minutes from us. He's going to see if maybe he writes the orders and sends it to them, if I can just get my treatment here so I don't have to travel. Is awesome. Like, how many doctors would do that? That's another reason why I really like him. Anyway, I just wanted to tell you guys what it's like to have rheumatoid arthritis and what I have to go through on a daily basis with taking medicines and the pain that I feel, and then having to go to doctor's appointments. And every month I have to go and get my blood drawn. They, keep a close eye on my sedimentation rate and my white blood cell count and different things like that. So every month I go and get blood drawn. He lets me get that done right here in the town that I live in. I just go to the lab. They have a standing order that's good for a year. They draw it. They send the results to my doctor. So he's very accommodating for me not living close to where his office is. So I really like that about him. He's a really good doctor to where he will take time out of his day and he'll call you to check on you. Like, every time I've had my infusions, he waits, like a couple days, or he'll call me and say, how did the infusion go? How do you feel? That's really good that he does that, and he calls, and it's like he actually cares. Like, you can tell that he really wants to help people. So thank you for watching this video. If you liked it, please give it a thumbs up, and if you haven't already, please hit that subscribe button, and I will see you in my next video.